Graston Technique is a unique method of instrument-assisted soft tissue mobilization where we use stainless steel instruments to assess and treat soft tissue dysfunction. The instruments are used first to assess the area that's injured. We assess the tissue and look for areas of what we call fibrosis, or tissue that maybe is not quite as mobile, it'll have a different texture. Once we identify those areas of fibrosis or lesions, then we use smaller instruments or smaller parts of the instrument to specifically manipulate those lesions. Try to break down those restrictions in the connective tissue, increase circulation to that area, and stimulate the body's own healing process. When you think of soft tissue injuries, you typically think of things like muscle strains, ligament sprains, tendonitis conditions, although more appropriately we should probably call those tendinopathies, which would include an acute tendonitis as well as a more chronic tendinosis condition. And those are quite different, and we do treat them quite differently. We can help with range of motion, again, by mobilizing the soft tissue to help improve mobility of the soft tissue, breaking down restrictions in the connective tissue, just improving the pliability or the mobility of the tissues. To help with pain control, we can use it in a desensitizing approach, where we very lightly brush the tissue with the instrument, and we found that's very effective at controlling pain or desensitizing the area. But also you can think that dysfunctional scar tissue itself can be a pain generator. There are nociceptors or receptors in the tissue that are responsible for transmitting pain. Well, by treating the dysfunctional soft tissue, we can actually affect those nociceptors and actually decrease the pain response from those types of cells.